Welcome back to The Why. I'm Cristina Mutchler. Could the phrase mind over matter apply when it comes to the opioid crisis? Some medical experts say yes, by way of using virtual reality. All across the U.S., doctors, political leaders, law enforcement, they've been searching for alternative methods to treat pain. Just today, in one of the hardest hit states, Ohio Governor John Kasich put into effect some new rules that limit the amount of opioids that doctors can prescribe. It'll now be 7 days for adults with acute pain, and doctors will have to write the diagnosis or the procedure code on all of those prescriptions. So could virtual reality literally be your next painkiller? VR is being used right now to transport patients with both acute and chronic pain to another world. In just 15-minute time periods, patients have reported decreased pain and better health outcomes. To better understand how VR could work as a potential solution, it's important to know what pain really is, neurologically, psychologically, and physically. I talked to Dr. Suresh, pediatric anesthesiologist at Lurie Children's Hospital in Chicago, about that.
Pain itself has two components to it, right? The component, so let's say I pinch you. You will feel the pain on your arm if I were to pinch you, right? About 10 minutes later, yes, you see me coming close to you, but you say, oh, geez, he's going to pinch me. I'm going to really feel this pain. But then you really don't feel the pain. It's the same thing, right? When you get a nick in your hand, you hurt a lot immediately, but a few, maybe a half an hour later, you really don't even seem to feel the pain. But then in certain modalities, what happens in certain instances, people psychologically are affected and continue to feel the pain. So someone who has, say, some sort of an injury to their limb, say a fracture, you get the fracture reduced. Most times they do pretty well post-operatively, but then there is an opportunity, there is a likelihood that some of them will have persistent pain. So there is a psychological component to pain as opposed to the nociceptive portion of pain, which is the pinching that feels pain. So my personal bias is that, virtual reality for the most part works by, shifting your thought process and, trying to cheat that part of the brain to understanding something else. Now you're shifting your concentration on pain because, the frontal lobe of the brain is constantly thinking about, how things are affecting my behavior. And that's what is being altered in these techniques.
You've probably used VR at some point, but I wanted to know more about how it's being utilized to combat the opioid crisis in real life. Cedars-Sinai Hospital in Los Angeles and virtual reality company AppliedVR is already doing that.
If I can basically hijack your brain, and if I can put cognitive load on to stop you from focusing on the pain and focus on something else, I can get you to feel less pain.
Just put on a pair of these VR goggles and your pain may start to melt away. Skeptical? Matthew Stoudt, CEO of virtual reality company AppliedVR, was too, until he researched and found virtual reality has outperformed opioids in pain management studies.
It was recognizing all of the work that's been done by our forefathers, that we're at a point today where we can actually make a real impact on pain. And so now we're racing as fast as we can to bring this to market in a time period where we literally are facing a pain crisis in America and an opioid epidemic.
Cedars-Sinai Hospital in Los Angeles has been ahead of the game, using VR to help combat our nation's opioid crisis.
What we've seen is, in many cases, incredible responses. I mean, truthfully, in the 19 years I've been practicing medicine, there's very few things that I can do in 3 to 5 minutes that provide as much quality of life benefit as bringing somebody in the hospital to Iceland. So it works, and I do believe it can be not a complete substitute for traditional medications, but at least it can supplement how we manage pain to help bridge people through their toughest times and give them an alternative rather than having to reach for a pill.
By the way, Dr. Brennan Spiegel, Director of Health Services Research at Cedars-Sinai, was also a skeptic at first.
When I first heard about virtual reality, I wasn't necessarily convinced it was going to be all that great. But all you have to do is try it first yourself to understand what it's like to be in VR. It's hard to describe that unless you've been in it. but then to see how patients respond.
The demand for non-pharmacological alternatives to managing pain, especially within this epidemic, is crucial.
We've seen in our hands that we can reduce pain by about 24% on average.
Cedars-Sinai is pushing for VR to be used on the front lines of clinical care, and it's not a one-size-fits-all solution.
We need a VR pharmacy. We need a set of evidence-based visualizations that are almost like on a shelf that I can reach to and map to my individual patient's needs.
Developing therapeutic VR as a commonplace pain management tool to reduce the opioid addiction in the U.S. is a collaborative effort, and the faster, the better.
In the world of healthcare, it takes a village to truly make a change. And so for anyone that's looking to help get this non-pharmacological solution, this virtual reality therapy out in the marketplace, we ask everyone for their help to do it. Spread the word.